Good day, dear friends. As many of us age, our joints start to hurt and our hearts start to worry. Pains appear. Some people have pressing pains behind the sternum, a feeling of lack of air. The rhythm is disrupted and there are disruptions in the heart's work. In this regard, each of us faces the problem of choosing a drug to relieve pain and inflammation in the joints, which, on the one hand, effectively relieves the pain syndrome, and on the other hand, does not have a harmful effect on the heart. And since nothing better has been invented to date for non-steroidal anti-inflammatory drugs for relieving pain and inflammation in the joints, one has to choose medicines from this group of drugs. So what can we actually choose? Let's start perhaps with diclofenac. The drug is quite good, easily handles joint pain, but it can provoke heart attacks and damage vessels. Therefore, it is not recommended for people with cardiovascular insufficiency, hypertension, and ischemic heart disease. Currently, diclofenac does not meet high safety standards. Let's examine Nimusulide. In practice, I have not once been convinced of its effectiveness. It easily copes with pain in the lower back. Moreover, it is relatively safe in terms of developing gastrointestinal bleeding. For relieving severe pain during a short-term treatment course, the advantage of Nimusulide is undeniable. But in terms of long-term therapy, the prospect is very doubtful. In addition to problems with the liver and kidneys, Nimusulide is contraindicated in severe heart and vascular insufficiency. Against the background of ischemic heart disease, hypertension, and a whole range of other cardiovascular diseases. At present, many rheumatologists love to prescribe so-called coxibs, and in particular the drug Arcoxia. Its effectiveness in principle is comparable to diclofenac, although in practice, Arcoxia often causes undesirable problems associated with arterial hypertension and cardiovascular insufficiency. From my point of view, this drug is most suitable for relieving pain and inflammation in the joints of young people, and I advise elderly patients to take Arcoxia in minimally effective doses, if possible, for a very short course. I emphasize this for your attention. Among all the group of non-steroidal anti-inflammatory drugs, Meloxicam is the most effective and safe, the main advantage of which is good tolerability. I do not recall a single case of heart attack development in patients who have been taking Meloxicam for a long time. This drug has another very important advantage. Unlike others, it does not interact unfavorably with low doses of aspirin. At the same time, it does not diminish its antithrombotic potential. This is a very important aspect. After all, most patients suffering from heart and vascular diseases are forced to take acetylsalicylic acid, cardiomegaly, thromboas, and others throughout their lives. So, when joints hurt and the heart is restless, I recommend Meloxicam to my patients. As practice shows, it is effective and relatively safe. Use my advice and stay healthy.